Seniors, stop right there. What if I told you that 4 common spices sitting in your kitchen cabinet right now could be silently destroying your digestive system every time you consume them on an empty stomach? Sounds impossible, right? But hidden inside these everyday seasonings are powerful compounds that react violently with aging digestive systems in ways most seniors never hear about from their doctors. This isn't just about a little heartburn or stomach discomfort. We're talking about dangerous chemical reactions, severe gastric bleeding, and toxic effects that can land you in the emergency room. And here's the terrifying part. Over 99% of people over 60 consume these spices daily without realizing the damage they're causing to their gut lining, blood vessels, and even brain function. Recent studies now show that certain spice compounds can trigger inflammatory responses 300% higher in seniors compared to younger adults. One spice on our list actually becomes toxic at doses as small as 2 teaspoons when consumed without food. That's less than what most people sprinkle on their morning eggs. Another common spice causes microscopic bleeding in the stomach lining that can persist for days, slowly weakening your digestive defenses with each exposure. But today, we're uncovering the real science behind why your aging body can no longer handle what it used to. In this video, we'll reveal the 4 spices you should never consume on an empty stomach after 60, the shocking truth about what they do to your body, and the simple timing changes that could save your digestive health. All backed by peer-reviewed research that your doctor probably hasn't told you about. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever experienced severe stomach pain after eating spicy foods? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further delay, let's talk about why your digestive system changes after 60, and why these 4 spices become dangerous weapons against your health. Here's what no one tells you about aging. Your digestive system undergoes massive changes that make it incredibly vulnerable to compounds that were once harmless. According to the National Institutes of Health, around 60 to 70 million adults in the United States have some kind of digestive disease. As we age, changes in our digestive organs make stomach issues far more common and severe. Your stomach produces significantly less protective mucus, the barrier that shields your gastric lining from acid and irritants. Blood flow to your digestive organs decreases, slowing healing responses when damage occurs. Your metabolism slows down, meaning toxic compounds stay in your system longer, and perhaps most critically, your body's ability to neutralize inflammatory substances diminishes dramatically. This creates a perfect storm where spices that once added flavor to your meals now become potential health hazards. When powerful spice compounds encounter an empty, aged stomach, the lack of food buffer combined with these diminished protective mechanisms creates an environment where even small amounts can cause disproportionate harm. The inflammatory response triggered by these spices persists longer in elderly individuals, leading to chronic digestive issues that compound existing health problems and potentially interfere with nutrient absorption. But it gets worse when you factor in the medications most seniors take daily. These 4 dangerous spices interact with common prescription drugs in ways that can amplify their toxic effects or reduce medication effectiveness. Blood thinners, acid reflux medications, diabetes drugs, and heart medications can all be affected. When consumed on an empty stomach, these interactions become more pronounced and potentially life-threatening. Now let's dive into the 4 spices that could be wreaking havoc on your health right now. Number 4, black pepper. Most people think black pepper is completely harmless. It's on every dinner table and every spice rack, and we've been using it our entire lives without a second thought. But for seniors consuming it on an empty stomach, black pepper becomes a dangerous irritant that can cause actual cellular damage to your gastric lining. The compound responsible for black pepper's bite is called piperine. While piperine gives black pepper its distinctive flavor, it also triggers significant increases in stomach acid production and pepsin secretion. Research published in digestive disease journals shows that black pepper administration causes gastric cell exfoliation, which means it literally strips away the protective cells lining your stomach. But here's the truly shocking part. Studies have documented actual gastric bleeding after black pepper consumption. One research subject experienced grossly visible gastric bleeding after consuming what most people would consider a normal amount of black pepper. This microbleeding can occur regularly with black pepper consumption, gradually weakening your stomach's natural defenses. The piperine in black pepper also reduces your stomach's secretion of healthy digestive juices while simultaneously increasing harmful free radical production. This oxidative effect triggers intestinal irritation that can persist for hours after consumption. Higher doses of black pepper have been compared to the harmful gut effects of a single dose of aspirin, which is known to cause mild intestinal bleeding. For seniors, this becomes even more dangerous because black pepper affects drug absorption. The piperine enhances the absorption of certain medications, which sounds beneficial until you realize it can lead to dangerous overdose effects. Blood thinners, antihistamines, and drugs processed by the liver can all be affected. When consumed on an empty stomach, these interactions intensify because the piperine is absorbed more rapidly and in higher concentrations. We had a patient named Robert, a 73-year-old retired mechanic who loved adding extra black pepper to his morning scrambled eggs. He came to us complaining of persistent stomach pain, dark stools, and fatigue that had been getting worse over several months. His doctor had tested him for everything from ulcers to cancer, but couldn't find a clear cause. When we reviewed his daily routine, we discovered he was consuming significant amounts of black pepper every morning on a relatively empty stomach, along with taking a daily aspirin for heart health. The combination was causing chronic gastric irritation and microbleeding that was slowly depleting his iron levels, leading to anemia and fatigue. Once we eliminated the morning black pepper and taught him to consume it only with substantial meals, his symptoms began improving within 2 weeks. His energy returned, and follow-up tests showed his stomach lining was healing properly. The key with black pepper is timing and quantity. If you're over 60, never consume it on an empty stomach. Always pair it with a full meal, and limit your daily intake to no more than half a teaspoon. Children, the elderly, pregnant women, and those with digestive disorders should be particularly cautious, as the spiciness can severely irritate the gastrointestinal tract. Number 3, turmeric. This one might shock you because turmeric has been promoted as a miracle health supplement, with claims about reducing inflammation and preventing disease. While turmeric does have health benefits when used appropriately, consuming it on an empty stomach can be devastating for seniors, especially those taking common medications. The active compound in turmeric is curcumin, and here's what most people don't know. Curcumin stimulates gastric acid production dramatically. When consumed without food, this acid surge can overwhelm your stomach's protective mechanisms, leading to severe acid reflux, nausea, and gastric irritation that can persist for hours. For seniors who already suffer from acid reflux, GERD, or peptic ulcers, turmeric consumption on an empty stomach can trigger painful flare-ups that may require emergency medical attention. The increased acid production can make existing stomach problems significantly worse, potentially leading to bleeding or perforation in severe cases. But the real danger lies in turmeric's blood-thinning properties. According to the British Heart Foundation, turmeric can thin the blood significantly, increasing bleeding risk. For elderly patients already taking blood-thinning medications like warfarin, consuming turmeric on an empty stomach enhances absorption and can lead to dangerous bleeding complications. The enhanced absorption occurs because there's no food to slow down the curcumin uptake. This means higher concentrations reach your bloodstream faster, potentially overwhelming your body's ability to process the compound safely. We've seen cases where seniors experienced unexplained bruising, prolonged bleeding from minor cuts, and even internal bleeding after regularly consuming turmeric supplements on empty stomachs. Turmeric also increases urinary oxalate levels, which sounds technical, but means your kidneys are working overtime to process compounds that can crystallize and form painful kidney stones. This risk multiplies when turmeric is consumed without food because the concentrated absorption overwhelms your kidney's filtering capacity. We treated a patient named Dorothy, a 69-year-old retired teacher who started taking turmeric supplements every morning on an empty stomach after reading about its anti-inflammatory benefits online. Within 3 weeks, she developed severe acid reflux that kept her awake at night, unexplained bruising on her arms and legs, and what she described as the worst stomach pain of her life. Her doctor initially suspected an ulcer, but when we discovered her turmeric routine, we immediately had her stop taking it on an empty stomach. We also coordinated with her physician to adjust her blood pressure medication, which had been interacting dangerously with the curcumin. Within 10 days, her acid reflux subsided, the bruising faded, and her stomach pain disappeared completely. The lesson here is clear. If you're over 60 and want to use turmeric for its health benefits, never take it on an empty stomach. Always consume it with a substantial meal containing healthy fats, which actually helps with proper absorption while protecting your digestive system. And most importantly, consult with your doctor about potential medication interactions before adding turmeric to your routine. Number 2, cayenne pepper. If black pepper is dangerous for seniors on an empty stomach, cayenne pepper is rations of capsaicin, a compound that triggers intense inflammatory, absolutely devastating. This fiery spice contains high constant responses throughout your digestive tract. For aging digestive systems, cayenne on an empty stomach is like pouring gasoline on a fire. Here's what happens the moment cayenne hits your empty stomach. The capsaicin immediately triggers TRPV1 receptors, causing massive increases in stomach acid production. This acid surge is so intense that it can cause immediate burning sensations, severe heartburn, and gastric irritation that can last for hours. But the real problem is that capsaicin is never entirely digested. A significant portion passes through your gut unchanged, continuing to trigger pain receptors and inflammatory responses throughout your entire digestive system. This means the damage doesn't stop at your stomach. It continues through your intestines, potentially causing cramping, diarrhea, and systemic inflammation. Research published in gastroenterology journals shows that even small amounts of capsaicin can cause gastritis and stomach ulcers in vulnerable populations. The study found that capsaicin caused gastrointestinal reflux symptoms not just in people who regularly suffer from heartburn, but also in those who normally have no reflux problems whatsoever. For seniors, this becomes a medical emergency waiting to happen. The aging stomach lining is already thinner and more vulnerable. When capsaicin triggers massive acid production without food present to buffer it, the acid can literally burn through protective tissues, causing ulceration and bleeding that may not heal properly due to reduced blood flow and slower cellular repair in older adults. The inflammatory response triggered by cayenne can persist for days in elderly individuals. Unlike younger people who might recover from spicy food reactions within hours, seniors can experience ongoing digestive distress, sleep disruption, and systemic inflammation that affects their entire well-being. We had a patient named Maria, a 71-year-old grandmother who prided herself on her traditional cooking. She had developed a habit of starting her morning with a small glass of warm water mixed with cayenne pepper, believing it would boost her metabolism and help with weight management. After just 2 weeks of this routine, she was experiencing such severe stomach pain that she couldn't sleep through the night. Her symptoms included burning sensations that radiated from her stomach to her chest, persistent nausea, and what she described as feeling like her insides were on fire. Emergency room visits found inflammation throughout her digestive tract, and she was diagnosed with acute gastritis directly linked to her cayenne consumption. Once we eliminated the morning cayenne routine and put her on a gentle healing protocol with soothing foods and probiotics, her symptoms gradually improved. But it took nearly 2 months for her stomach lining to fully heal, and she still experiences occasional flare-ups when she consumes any spicy foods, even in small amounts with meals. The key message here is that cayenne pepper should never be consumed on an empty stomach by anyone over 60. Even tiny amounts can trigger dangerous inflammatory cascades that can take weeks or months to fully resolve. If you enjoy spicy foods, save them for the middle of substantial meals when you have plenty of food to buffer the capsaicin effects. And now we reach the most dangerous spice on our list, the one that has actually caused organ failure and death in documented cases. Number 1, nutmeg. This might be the most shocking entry on our list because nutmeg seems so innocent. It's used in holiday baking, sprinkled on eggnog, and found in countless recipes we've enjoyed for decades. But nutmeg contains a compound called myristicin that becomes genuinely toxic when consumed in amounts that many people would consider normal for cooking. According to case studies from poison control centers, even 2 teaspoons of nutmeg is enough to cause symptoms of toxicity. At higher doses, those symptoms become severe and potentially life-threatening. The terrifying part is that when nutmeg is consumed on an empty stomach, absorption is rapid and concentrated, meaning toxic levels can be reached much more easily. The myristicin in nutmeg affects your central nervous system, causing hallucinations, confusion, rapid heartbeat, and severe gastrointestinal distress. In documented cases, nutmeg toxicity has caused organ failure and has been linked to deaths, particularly when combined with other substances or in individuals with compromised health. For seniors, the danger is amplified because aging bodies process toxins less efficiently. The liver, which is responsible for breaking down myristicin, works more slowly in elderly individuals. This means toxic compounds stay in the system longer, allowing them to cause more extensive damage to multiple organ systems. The symptoms of nutmeg toxicity can include nausea, vomiting, dizziness, confusion, hallucinations, rapid heartbeat, and severe abdominal pain. These symptoms typically develop within hours of consumption and can persist for 24 hours or longer. In some documented cases, psychosis has lasted for up to 6 months after a single toxic exposure. What makes this particularly dangerous for seniors is that many of these symptoms can be mistaken for other age-related health issues or medication side effects. A senior experiencing confusion or rapid heartbeat after consuming nutmeg might not connect it to what seemed like a harmless spice, leading to delayed treatment and potentially serious complications. 4 spices that seem harmless but can silently destroy your health when consumed on an empty stomach after 60. Black pepper, turmeric, cayenne, and nutmeg all become dangerous weapons against your aging digestive system. The solution isn't to avoid these spices entirely, but to respect your body's changing needs. Always consume them with substantial meals, never on empty stomachs, and consult your doctor about potential medication interactions. Your digestive health is too precious to gamble